Oh my God, guys, you did it! Yay! That is so cool. I'm so happy to have you as colleagues. Some of you are my friends, some of you I've known, some of you I've yet to know. Thank you, Dean Ruge, Dean McCauley, Executive Vice Deans Weinstein and Kunkel, and the esteemed faculty here today. Thank you to the University of Michigan custodial staff who has set up and will clean the auditorium, and the many, many staff and workers who support this event. And most of all, congratulations to the University of Michigan Medical School class of 22. My deepest thanks and our deepest thanks to the families and friends and people who have supported these brilliant young people through their journey to become doctors. It is a great and wonderful gift that all of you have given your loved ones to be able to be doctors. And I'm very honored to be selected to give this, the first in-person commencement speech during the COVID-19 pandemic. This pandemic, the worst one in modern history, has put medicine and public health on the map as never before. The medical science we witnessed was breathtaking, just breathtaking. Understanding the virus, the immune system, the host response, translational research to bring about the development of vaccines and therapeutics, bench to bedside at its best. Yet COVID-19 has provided for all of us an object lesson in inequity. Both in the United States and around the world, the risk of contracting COVID-19, the access to preventive vaccines and to life-saving therapeutics, and the health outcomes of those who fall sick with COVID-19 map the fault lines of our global society. Black Americans are 3 times more likely to die of COVID-19. Only 1% of people in the nation of Burundi have been vaccinated. And the children of day laborers in India have experienced some of the worst malnutrition since the Great Famine. This we know. Biomedical wonders alone have and will continue to fail at ending the pandemic. Rather, social, political, and economic aspects of COVID-19, such as pre-existing poverty, food insecurity, high-risk living and working conditions, the politicization of health, and the failure of the market to deliver equitable distribution are driving the pandemic and all of the consequences the world faces. It is a challenge to become a doctor at this time. It is a challenge to be you. Sorry. But a medical degree is like an artist's palette. You get to decide what to paint on the canvas of your life. You can paint a still life, perfect in its proportions, focused on a single bowl of fruit. You can ignore inequalities and ignore context. Really, I'm not being cheeky here. You can enjoy the practice of medicine and your patients. You can enjoy the world you define. You can treat illness, save lives, and enjoy the privileged position of being a doctor. Importantly, if that's what you do, be excellent. It's cool. We need good doctors of all stripes. Thank you. No. Okay, if that was my speech, of course, it would be a very short message indeed. So here is your second choice. Paint something large. Paint something like Picasso's Guernica or Faith Ringgold's American People series. Explore the human condition, the beauty, the pain, understand, and even embrace the complexity. And of course, be excellent. That's a given. Nothing in life is truly binary. However, as you begin the next exciting chapter of your life, I want to offer you a piece of advice that transcends biomedical science, but is the part of medicine that is contextual, that maps the contours of the world that we call social medicine. The father of social medicine is none other than Rudolf Virchow, the 19th century physician, as he famously studied an epidemic of typhus, which is often called hunger typhus, in Upper Silesia. Virchow documented the root cause of the epidemic: privation, hunger, squalor, lack of employment. Virchow called for social change to address this epidemic. He wrote, "The earth brings forth more food than people can consume. The interests of the human race are not served when by an absurd concentration of capital and landed property in the hands of single individuals, production is directed into channels that always guide back to the flow of profit and into the same hands." Virchow wrote that. He called for physicians to be the natural lawyers of the poor. And like lawyers, he urged us to collect the evidence of the root causes of suffering, to advocate for change with the evidence we have gathered, and in doing so, to seek justice. Yikes, like that can be pretty overwhelming. Or thinking like, Joia, we just finished medical school, now you want us to be a lawyer? Can you imagine the debt? But hear me out, hear me out. While the color palette and the practice of social medicine may be complex, it can be boiled down to just three things, whether you're a surgeon, an orthopedist, an OBGYN, whether you're a pediatrician. It can be boiled down to three things: proximity to patients and caregiving, an analysis of the social conditions in which your patient lives, falls ill, and dies, and action to remediate those root causes of suffering. So let's start with the fun part: proximity. Regardless of how busy you are, it is well worth your time to know your patients, because patients are people. I probably don't need to tell you that. You took anatomy, and you are also a person. The art of medicine is rooted in that human connection. Indeed, many of the attendings you most loved, the professors you most loved, were those connected to your patient. Whether it was Mary with her hip fracture, Philip with his brain tumor, Ahmed with hypertension, or Yelena with schizophrenia, learn who your patients are, not just the disease they have. Your practice will have more meaning, as your dean said, and you will have much more fun, and you will be a better doctor. One of the factors in the epidemic of burnout we hear in our profession is the disconnection with care, is the disconnection with the humanism that brought all of us here. Let's be frank. We came here because we like people, we care about people, we want to help people. Stay connected. It will save you. My lesson in proximity came early as a third-year medical student. Breed love was the name on the chart I picked up on rounds. My medicine rotation with my favorite professor, and I really wanted to shine. I examined Mr. Breedlove from head to toe, did a very thorough H&P review of systems, family history, social history, an excellent assessment, if I must say, and a plan. I spent at least an hour writing a 5-page note. Yes, I was destined to be an ID doctor and not a surgeon. And when it came time to present, I was a machine. I was a gunner. I went through every detail from memory, keeping the presentation organized, staying to the requisite 2 minutes, and barely taking a breath till I was done. My attendant seemed very pleased. But then, to my surprise, he looked at me and said, "Please go back into that room and talk to the patient." I stammered, "Well, no, I did talk to him. I talked to him, yeah, for like 2 hours." And he said, "What's the social history?" I rattled off, "No alcohol, non-smoker, no IV drug use." The attendant was now very annoyed. "Joia, please return to the room and talk to the patient." I re-entered the room more than a little bit embarrassed to restart a conversation after spending an hour with this man. I didn't know what to say. So I said, Mr. Breedlove, sir, can you tell me a little bit about yourself? Oh my God, the man lit up. Call me Maceo, Doc. I was born in 1900 in Fayetteville, Alabama. I have lived these 90 years. All I ever wanted to do was play baseball, and I was a slugger. He demonstrated his swing while he was laughing heartily over the buzz of the oxygen humidifier. He was so warm and so fun to talk to that my anxiety about really getting to know him melted away. He took care of me that day, of my anxiety. Maceo recounted the 22 years in the segregated professional baseball leagues. He hit a 2-run homer off Satchel Paige, the storied Negro League pitcher. He traveled across the country during the height of the Jim Crow era, making no more than $100 a month, and often sleeping rough in so-called hobo camps. When we didn't have money, Joia, for food, do you know what we did? No. I explained to him by that time that he should call me by my first name because I wasn't a doctor yet, but from this day forward, you never have to do that again. He smiled broadly. He said, we got our poles and we fished for dinner. We cooked that fish up on an open fire. Maceo, I said, do you know that Taj Mahal song? And he started to sing. I'm going fishing all of the time. Ain't you going fishing too? Bet your life your sweet wife is gonna catch more fish than you. Many fish bite if you got good bait. Here's a little tip I like to relate. Many fish bite if you got good bait. I'm a-going fishing, yes, I'm going fishing, and my baby's going fishing too. Well, being a singer, I had joined in on the second word. I was a harmonette at the University of Michigan, and I used to perform here at Hill Auditorium. By the way, my dear, said Maceo, it was Doc Watson wrote that song. Taj just covered it. Learned something else. On rounds with my attending after I finished my bedside presentation, Maceo laughed and he said, Doc, this lady's a singer, do you know that? My attending beamed. I had done what he expected. I stayed connected with Maceo until his death in 1993, seeing him a few times outside the hospital and in the clinic with my attending. My connection with Maceo and the thousands of other patients that I have connected through bring me great joy. That is the nature of the human condition. I was blessed to learn about this lesson of proximity and care and joy early, and I pursued residency, as I hope you do, with an open heart. Yet proximity to people who are sick and suffering is not always joyful. And in fact, it taught me about the cruelty and indeed violence of the social determinants of health, the forces like racism, gender inequality, and impoverishment that cause and maintain ill health. I visited an American World War II veteran with tuberculosis who couldn't afford an apartment and lived under a bridge. I spent time with a Ugandan teenage girl with HIV who, as the head of her household, had to trade sex to feed her brothers and sisters. I walked with an indigenous elder who lived through the trauma of the US boarding schools and never could escape the grips of depression. These adverse social determinants seemed insurmountable to me. Fortunately, just as proximity to patients and providing care for them forced me to analyze these social determinants, I met the greatest social medicine scholar of the 20th and 21st century, Dr. Paul Farmer. Some of you know of Paul's work. Paul is the founder of the organization that I serve as chief medical officer for the last 25 years. Paul was a medical anthropologist whose life was informed, like mine, by the choice of proximity, by the choice of caregiving. He worked in Haiti as a young person, and the patients never left his heart. As a scholar, he doggedly assessed and wrote about the social determinants, the material, political, and economic factors that caused health inequality. His brilliant analyses are captured in his canons of books and articles and speeches. But perhaps most importantly, Paul was a practitioner of social medicine, not just a theoretician. For a quarter of a century, I worked side by side with Paul as Chief Medical Officer of Partners in Health, the organization he founded in 1987. Today, we are in 12 countries with a staff of 19,000, 95% of whom are local to the countries they work, and 85% are those who have suffered the structural violence of poverty, war, gender, and racial inequality. Like Archbishop Desmond Tutu, like Brazilian educator Paulo Freire, like journalist Ida B. Wells, Paul rejected the notion of neutrality in the face of oppression, and I hope you will too. Paul wrote, "I have been a witness in every sense, a partial witness. I am openly on the side of the destitute, sick, and I have never sought to represent myself as a neutral party. PIH is an organization that is proximate to suffering and therefore rejects neutrality. Medicine will bring you proximate to suffering, and I hope that you will also reject neutrality. It is injustice that makes the poor more likely to get sick, suffer, and die. It is not a microbe. It is not behavior. In doing this work for the last quarter of a century, burnout has not been a significant aspect of my life. Because what Paul taught me, and indeed what PIH taught me, is that none of us do this work alone. None of us do this work alone. Proximity to patients serves to remind us of this human family we've pledged to serve. And importantly, we as doctors are only one small part of a team that begins with patients themselves, their families, their loved ones, their communities, and all the caregivers in their life. Find your people. Build your team. Center love and caregiving in your practice, whatever that may be. Sadly, my dear friend Paul died unexpectedly in February at age 62. He was in rural Rwanda at the University of Global Health Equity, teaching social medicine until he died, because he believed that nothing was more important than achieving health equity. And to achieve health equity in whatever branch of medicine requires training a generation of people to get close to patients, to assess the social factors that make and keep them sick, and to work to change those factors. University of Global Health Equity was founded by PIH in partnership with the community and with the government of Rwanda. And we're enormously grateful for the significant support we've had from the University of Michigan Medical School and nursing schools. They have supported us in developing programs in trauma care and quality improvement. They have supported teaching and training. In fact, the current University of Medical School Dean for Education and Global Initiatives, Dr. Joseph Kohler, sits on the UGHE Dean's Advisory Council. Dean Kohler's, Dina Bebe says hi, by the way. Proximity to suffering could have broken me in my early days as a student. I was tempted to just focus on that bowl of fruit, to just paint the still life, and to be done with it. But instead, I found my people. People who love others. People who are willing to get close and accompany people on their journey. Our team is multidisciplinary, multinational, and really, really fun. Even as we work daily to fight against the social forces that oppress people and make them sick. All our staff, from our cleaners to our surgeons, from nurses to drivers, are all practitioners of social medicine. Sergei, a driver in PIH Siberia, could find any formerly incarcerated man to deliver their drugs for MDR-TB. Montreux, an agricultural worker in Haiti, visits the homes of children with malnutrition to help their parents plant trees with fruit that they can sell at market. Dr. Jaime in Peru brings diabetes medicines to patients in the slums when they're quarantined for COVID-19. And in Malawi, Victoria, a midwife, found a family for baby Diana, whose mother died in childbirth. With PIH's support, that little girl is now in secondary school. These are not isolated stories of individual charity, but action that springs from a root cause to analyze the cause of suffering, marginalization, chronic food insecurity, lack of transport, lack of a social safety net. Social structures are more responsible for life and death than genetics or biology. The #1 metric for life expectancy in the United States is zip code. Zip code. It is the oath we take to care for the person in front of us to the best of our ability, not the disease, the person. The person as they exist in their family, in their community, and indeed the world. For the rest of your life, you will take the knowledge and skills you've learned here at the University of Michigan and shape your practice. I have no doubt that you will be brilliant doctors, capable of curing disease, discovering new therapies, setting broken bones. Your canvas may be focused or as expansive as society itself, and I have no doubt you will paint it beautifully. But whatever path you take, find your people and choose proximity to patients and care. Ask your patients, as I queried Maceo Breedlove more than 30 years ago, something as simple as, tell me a bit about yourself. Proximity will help you think of the whole person before you. An analysis of the struggles they face will help you work with them and others to find potential remedies. And in developing your unique art of medical practice, it is not the microbes you study, the cardiac caths you do, but how you use them, along with your talents, your passions, and your approach to paint your canvas and transform each and every one of you from a doctor into a healer. Best of luck to all of you, and I can't wait to see what you do next. Thank you.